Hey everyone, welcome back. So, in today's lesson, we're diving into something a lot of people deal with, but don't always talk about, and that's Irritable Bowel Syndrome, or IBS. If you've ever felt bloated, cramped, or had to rush to the bathroom right after eating, and then had all your tests come back normal, you've probably heard the term IBS tossed around. In this video, I'll walk you through what IBS actually is, how it shows up in the body, how doctors diagnose it, and what can be done to manage it. And trust me, you'll want to stick around till the end because some of the newer treatment options are actually kind of surprising. All right, let's jump in. So, what exactly is IBS? Irritable bowel syndrome is what we call a functional gastrointestinal disorder. Now, I know that sounds a bit technical, but all it really means is there's nothing structurally wrong with your digestive system. Everything looks totally normal on scans or scopes, but it just isn't functioning the way it's supposed to. Think of it like this. Your gut is kind of like a smartphone that freezes or glitches for no reason. It looks fine on the outside, but something's off with how it runs. Now IBS is super common. It affects around 10 to 15% of people worldwide. But here's the tricky part. It doesn't have just one cause. It's more of a combination of things, like gut sensitivity, stress, changes in gut bacteria, your diet, and yeah, even the way your brain and gut communicate. That's what people call the brain-gut connection. So what does IBS actually feel like? What are the signs and symptoms? Well, the big one is abdominal pain or cramping, and here's the weird thing. It often feels better after you go to the bathroom. Then there's bloating and gas. A lot of people describe it like there's a balloon in their belly. You just feel kind of puffed up and uncomfortable. And of course, changes in your bathroom habits. Some folks have diarrhea, others have constipation. And some people, they flip-flop between the two. So based on all that, doctors usually classify IBS into a few subtypes. There's IBS-D, which is diarrhea predominant, IBS-C, which is constipation predominant, IBS-M, which means mixed, so you get both diarrhea and constipation, and IBS-U, which is unclassified, meaning it doesn't fit neatly into the other categories. Now, on top of all that, some people notice mucus in their stool. Others feel like they didn't really finish their bowel movement. Oh, and fatigue is super common too. A lot of folks with IBS also report trouble sleeping. But, and this is important, IBS doesn't cause things like bleeding, unexplained weight loss, or fever. If you have symptoms like that, your doctor's definitely going to want to rule out other conditions, like inflammatory bowel disease or colon cancer. So yeah, always talk to your doctor about anything that feels off. So then the question becomes, how do we actually diagnose IBS? Well, there's no single test. IBS is what we call a diagnosis of exclusion, which just means doctors have to rule out other stuff first. They'll ask you about your symptoms, your history, maybe do some blood work or stool tests, and sometimes even a colonoscopy, just to make sure nothing serious is going on. And once they've ruled all that out, they'll often use something called the Rome 4 criteria. It's basically a checklist. If you've had belly pain at least one day a week for the last 3 months, and that pain is linked to things like changes in how often you poop, or what your stool looks like, that might point toward IBS. Okay, so now the big one, how do we treat this thing? The answer is, it depends. IBS treatment isn't one size fits all. It's more like a toolkit, and you use different tools based on your symptoms. First off, let's talk about diet. Probably the most talked about approach right now is the low FODMAP diet. FODMAPs are fermentable carbs found in foods like garlic, onions, beans, apples, and even wheat. For people with IBS, these carbs get fermented by gut bacteria and can cause major gas and bloating. So with the low FODMAP diet, you cut those foods out for a few weeks, and then slowly reintroduce them to figure out what's actually triggering your symptoms. Now, another huge piece of the puzzle is stress. The brain and the gut are super connected. That's why stress can literally trigger IBS flares. So tools like mindfulness, therapy, especially CBT, yoga, or even just regular walks can actually help calm your gut. Next up, medications. If you've got IBS-D, meaning diarrhea predominant, doctors might give you something like loperamide to slow things down. Or in some cases, an antibiotic called rifaximin that targets gut bacteria. If you've got IBS-C, so constipation, there are options like laxatives or prescription meds, like lubiprostone or linaclotide that help move things along. Now, for pain or cramping, things like peppermint oil capsules or antispasmodics can help relax the gut muscles. And in some cases, doctors use low-dose antidepressants, not for depression, but because they help calm the nerves in your gut. Oh, and about probiotics. Some people swear by them, others see no difference. The evidence is kind of mixed, but it might be worth trying, especially strains like bifidobacterium. But you know what might be the most important part of all this? Reassurance. Seriously, just knowing that what you're dealing with isn't dangerous, that you're not alone, and that there are ways to manage it. That can take so much of the fear and anxiety out of the whole thing. Alright, so let's do a quick recap. IBS is a functional gut disorder, meaning the gut looks normal but acts out. Symptoms include belly pain, bloating, and bathroom issues, like diarrhea, constipation, or both. There's no one test to diagnose it. Doctors rule out other conditions first, then use symptom criteria. If you are interested in learning more about the symptoms of colon cancer, please watch the video in our video description. Regarding treatment, it's a combo of diet, stress reduction, medication, and good old-fashioned support and education. If you're someone who's been struggling with this, or you think you might have it, please know there is help, and there is hope. Alright, that's it for today's video. If you found this helpful, give it a like, hit subscribe, and maybe even share it with someone who could use this info. Thanks so much for watching, and I'll see you in the next one.